the index finger and travels along here through this red dot we just created, and then along here, which just have a picture on like this, and then along here to the elbow, comes up, does a little thing going back here, comes up, goes through this little depression here on the shoulder, and then across the shoulder part of the traps. There is a part that connects to the spine, and then it comes around, comes up to the face, around, and then ends on the opposite side in the nasolabial groove halfway of the ala nasi. So that's the general pathway. So large intestine 1 is at the radial side of the nail bed of the index finger. I'll do large intestine in red since we started that already. That's one. Large intestine 2, we find the joint from the second metacarpal to the phalange, right, or the digit, and the distal side of that. Okay, so with a soft fist, here's the joint, and I want to go just distal to it. That's large intestine 2. For 3, I'm just going to go to the other side of that joint. Large intestine 4 is located. We're going to find the second metacarpal, and I want to find the proximal end and the distal end, and I want to find the halfway point. And I'm going to go right next to the bone. We know that this is 5. We already did that one. So we find that one by bringing the thumb back, and it creates a little space where it's got an outline or a border with 2 of the ligaments here, or tendons. Okay, and the soft spot in the middle is large intestine 5. Now we need to find large intestine 11, which is at the elbow, because we're going to use the line from large intestine 5 to large intestine 11 to locate our points. Large intestine 11 is at the elbow, halfway between lung 5 and the lateral epicondyle of the humerus, and it's also at the lateral end of the transverse cubital crease, lung 5. Lateral epicondyle is the bone here. If you're all the way back here, that's called the olecranon process. That's the true elbow. As far as when people think about the elbow bone, the elbow is actually this whole thing, but as far as what people think of, this is actually the olecranon process. So from that pointy bone, I'm actually going to come around a little bit and find another slightly protruding bone here. That's the lateral epicondyle. So to locate large intestine 11, I'm going to put my thumb on that epicondyle, and I'm going to put my middle finger on lung 5, and I'm just going to kind of locate the halfway point there. And if you look closely, you'll see that the cubital crease, the line, ends right there. So that is large intestine 11. Now that's large intestine 5, and I'm going to use the distance or the measurement from here to here. You'll notice in the book, though, it doesn't just go in a straight line. It goes in a straight line and then kind of curves here. So we have to find that curve to make sure we're locating the points properly. Our next point is large intestine 6, which is 3 cm proximal to large intestine 5 on the line connecting large intestine 5 to large intestine 11. 25 blockets. So I want to put I'm going to use the regular side, the smaller sections up to 20, and I'm going to put my 0 here. The distance from the wrist crease to the cubital crease is 12 cm, so I find my 12, and if I don't stretch it on this patient, I only get to here, so I have to stretch it. So that shows me where I have to go. So large intestine 6 is located 3 cm proximal. So here's my 3, but that's not exactly where I want to be, because that's a little too far towards the lung meridian. But that shows me where I want to be as far as distance from here. So if I follow this line mostly straight, it's going to end up being right here. So that is 6. Large intestine 6. And large intestine 7 is located 5 sun proximal to Li5 on the line from Li5 to Li11. So using the same cunometer measurement, I'm going to go from 5 to 11, which is 12 sun. Li11 is at the 12 sun. Kitty. Okay, so I've got 3, and then I want to go to 5, which is right here. So again, staying in that line, and that's 7. Now a little tip, 8, 9, and 10 are located at the 8, 9, and 10 sun measurements. So I'm going to put my 0 here, take my 12, stretch it out, find my 8 sun measurement right here. And it's going to start to curve. So I'm going to feel the muscle here, and I can feel that there's a curve to the muscle. I'm in between 2 muscles, 8. Nine, 10. Large intestine 12 is in a depression 1 sun proximal and 1 sun lateral to Li11. So proximal will be going towards the torso in the direction this way. So let's see if we can locate that. So 1 sun proximal and 1 sun lateral. So lateral is this way, proximal is this way. So I know that my thumb is equivalent to my patient's. So I'm going 1 sun up, which puts me here, and 1 sun lateral, which puts me here. 12. Li12, large intestine 12. Large intestine 13, on the lateral side of the upper arm, 3 sun proximal to Li11 on the line connecting Li11 with Li15. In the book it shows the arm in position like this, and we're looking down at it, but we're going to do it with the arm at the side. So large intestine 13 is 3 sun proximal to Li11 on the line drawn from Li11 to Li15. So I have to show you Li15. So on the shoulder, if you palpate the deltoid, okay, if you come from the bones and follow them over, you find a depression right here. There's also a depression here, okay, depression on the posterior, depression towards the front. The one towards the front is large intestine. And the one towards the back is Sanjiao. So we're doing large intestine, we want this one. So this is 15. And one of the ways that you can locate this is to have the patient bring their arm out, and you can find the 2 depressions more easily, okay? Because when they contract the deltoid, the muscles contract, and what we're actually feeling is between the upper attachment on the deltoid muscle. So there's a front deltoid, there's a medial deltoid, and there's a posterior deltoid. And they are separated, and where they attach up here, there's a little gap in between. So that's what we're actually palpating. So now to find Li13. We have Li11, and we're using that to find Li13. So the distance from the cubital fold to the axillary fold is 9 sun. So I'm going to measure to the axillary fold because that's the measurement that I know. So I put my 0 here, and I take my 9, and what I'm trying to reach is here. So I'm going to put my 9 at the level of the axillary fold here. So 9 is here, and I want to be on the line from Li15 to Li11. Oops, my 0 here. And I want to be 3 sun, so that puts me right here. And I want to locate it on the lateral part of the biceps between the bone. So that's going to be right here. Another way to do this is to use the 3 sun measurement, 4 fingers together, And remembering that my patient's is slightly smaller than mine, and that puts me here. And remember what you're palpating for here are the bone and the muscle, and I want to go in between. LA14 is located on the lateral side of the upper arm in a visible tender depression formed between the distal insertion of the deltoid muscle and the brachialis muscle. Approximately 3/5 of the distance along the line drawn between LI11 and LI15. So I prefer to teach this just through the palpation of the deltoid. So we can find the deltoid muscle here. It's an upside down teardrop or water droplet. It's about, I would say, not quite halfway down. If you go down the outside of the arm, you'll find a bump. That's the tubercle, the deltoid tubercle, the bone. It's a little piece that sticks out of the upper arm bone, which is called the humerus, and that's where the deltoid muscles all come down and converge to attach to the arm. So when I find that, I want to go slightly anterior to that. So the humerus bone goes from up here to here, and where we're going to find that on this patient is right here. So it's not quite halfway, it's a little above halfway. And then I want to go just a little interior where I'm on the front of the bone and not on the muscle. That's 14. We already located 15. It's the anterior depression in the deltoid muscles. And the large intestine 16 is on top of the shoulder in a depression medial to the acromion process and between the lateral extremity of the clavicle and the scapular spine. Okay, so what does that mean? So I want to find the lateral end of the clavicle, which is here, and the scapular spine, which we can palpate on the scapula, the shoulder blade, and where these two come out and meet, right? The clavicle really ends here, but this is the acromion process of the scapula, and it comes around here. This is all bone. So as I'm coming up the arm, I can just follow that up, and when I come over the bone here, that's where I want to be. So we're going to locate that here. There's a depression there, and that is 16. So here's the clavicle coming across. And here's the acromion process. This is kind of a flat bone coming from the scapular spine. This is a bone of the posterior shoulder. And these come out here together to create part of the shoulder. And what I'm doing is I'm palpating over that bone to the soft tissue. And our large intestine 16 is located just inside of that. So large intestine 17, on the lateral side of the neck, one cell inferior to LI18. So let's find LI18 first. Large intestine 18, on the lateral side of the neck, level with the tip of the laryngeal prominence, that's also called the Adam's apple, between the sternal and clavicular heads of the sternocleidomastoid. So we got a few anatomical things to locate there. So can you turn your head? And then, sit up just a little bit straighter. Okay, turn your head. Yeah. Okay, so the patient's got her head turned, and just behind the ear, there's part of the temporal bone called the mastoid process. That's part of the sternocleidomastoid bone, muscle, sorry. And then here's the muscle coming down, and this is called the sternal head because it goes down to the sternum, and this is tendon that we're seeing right here. And then just lateral, it has a branch that branches off here, and it comes down here to the clavicle. This is the clavicle bone. So it's called the sternum clavicle mastoid process muscle, sternocleidomastoid. That's how the muscle is named, but we call it SCM for short, so SCM, sternocleidomastoid. So that's the muscle there. Just turn a little bit more, and then push your head against my hand. You can really see it come up there when it gets contracted. Okay, you can relax. So that's the first thing, the sternocleidomastoid. And LI18 also, we have to locate the laryngeal prominence. So in women, it's a little bit harder to locate. Turn your head to the side. If we come up here to the soft portion of the neck, we can find the top of the thyroid cartilage. What we want to do is just come to the most prominent part, which we can kind of see in the patient, which is a little bit more helpful. right there. That's the level that we want to be at. So bring yourself back to middle. Just sit and go on. So right here is the laryngeal prominence. Okay, so we've got our laryngeal prominence. We have our SCM muscle. Okay, and what I'm going to do is I'm going to have the patient turn her head to the opposite side again. Bring that muscle up. Here's the laryngeal prominence. At that level, I'm going to find the SCM muscle, and then she's going to bring her head back. And I want to go to the spot in between the two heads, which I can palpate here. Okay, palpate the two heads, and I'm going to put my dot here. So LI18 is on the lateral side of the neck, level with the tip of the laryngeal prominence, between the sternal and clavicular heads of the sternocleidomastoid. So I showed you the attachments down here, but what we're palpating up here is that we can feel a very subtle split in this muscle. It's very subtle. Now that's 18. We did 16 and we did 18, we need 17. LI17 is 1 cent inferior to LI18, but on the posterior border. So I'm going to palpate again for this muscle. It's best to start up here if you can. You can't palpate it on everybody quite so well. And then LA18, I'm going to go 1 cent down from that. But on the posterior side. Okay, 17, 18. 17 is on the back side of the muscle. So 17 is on the posterior side of the muscle. Got to palpate for it. And 18 is in between. Anything where you have to rotate the neck to locate and come back, when any movement of the head or neck will make the point that you located on the surface look a little different. Because the superficial anatomy changes, right? So when she turns, it changes things. Here's this SCM, and 18's on the back, 17 is not nowhere near the muscle. But when we go back to the position that we located in, then we find that they're where they're meant to be. Okay, large intestine 19 is located by palpation. Can you touch your face? Under the nose, here's the filter, and we're going to go lateral, just under the lateral part of the alanasi. And I'm going to palpate there, and I'm going to feel a little crevice in the bone. It feels like a short grain rice or a half a grain of rice. That's 19. I'm just going to put the dot and not the number. Large intestine 20 is in the nasolabial groove at the level of the midpoint of the alanasi. So we're looking for what we call a smile line. So can you just smile a little bit? And we can kind of distinguish it there a little bit more. So following that up and halfway of the alanasi. So the alanasi is where the nose flares. Okay, that's the alanasi. So I want to go halfway and in that nasolabial groove. On the face, we have 19 and 20. 19, you palpate for a crevice in the bone under the skin, and 20, you locate half the distance of the alanasi and in the nasolabial groove, which is the smile line. Some people don't have smile lines, so we have to ask them to smile. I think eventually everyone gets them. 17 and 18 are on the neck. 16 is on top of the shoulder at the lateral end of the shoulder. This is the acromion process. And then we have soft tissue here, that's 16. 15 is the front depression in the deltoid muscle. 14 is at the deltoid attachment, just anterior to the attachment, in front of the bone, but between the muscle and the bone. 13 is 3 sun, proximal to 11. So we can measure like this, or use the cunometer. And it is between the muscle and the bone also. 12 is located 1 sun, proximal and lateral to LI11, which you can use your thumb for lateral and proximal. 11 is located at the end, the lateral end or the radial end of the transverse cubital crease. In this position, we can see the forearm points very easily. The distance from the wrist crease to the cubital crease is 12 sun, and LI11 falls at the 12 sun line. And so if we go 2 sun distal to that, we find LI10. and then one more sun is 9, one more is 8, and then we find Li7 at the 5 sun mark. From Li5 to Li7, that's 5 sun. Li5 to Li6 is 3 sun. Li5, we've located that a few times already. 4 is half the distance of the second metacarpal. 3 is proximal to the metacarpophalangeal joint. 2 is distal to the metacarpophalangeal joint. And we find large intestine 1 on the radial side of the index finger.